Well, while Australia's two biggest cities are in lockdown, England is opening up today, marking the end of COVID-19 restrictions. It's called Freedom Day in the UK, and it means masks will no longer be compulsory, social distancing will be abolished, and nightclubs and theatres will fully reopen. The easing of restrictions comes as the British Health Secretary, Sajid Javid, tests positive for COVID, forcing the Prime Minister and other Cabinet Ministers to self-isolate. Professor Susan Michie heads the Centre for Behaviour Change at the University College in London and is a Minister of the UK's Scientific Advisory Group for Emergencies Committee. Susan Michie, welcome to RM Breakfast.
Thank you, and speaking in my personal capacity this morning.
Okay, thanks. Susan, daily COVID numbers are still high, hit a worrying 50,000 yesterday, I think it was. Should England be opening today, or is it, as some has described, a reckless and unconscionable gamble?
Well, 1,200 scientists and health professionals signed a letter published in The Lancet last week saying that this was a reckless gamble. We're in a situation of very high transmission, exponentially rising, a pandemic that's out of control, a vaccination programme that's only halfway through completion. And this is a situation in which if we are to remove further restrictions, we will see even greater transmission with many harmful effects, which includes putting the whole population at risk of a new variant emerging, which could completely undermine the vaccination programme, which means potentially another 500,000 long COVID cases on top of the million we already have, which means further pressurising an exhausted National Health Service, where already the surgical and medical wards are being once more made into COVID-only wards, and already emergency departments say they're at bursting point.
Yeah.
And we have children who are going to be exposed to infection with a lot of deleterious effects.
Okay, let's break that down a bit. The vaccination rollout, you've said it's only half done. I thought 88% of the adult population had received one dose and 2/3, 35 million people, fully vaccinated. From where we sit, that looks pretty good.
Yep. So first of all, what the evidence shows is that one dose is really not very protective. You do need 2 doses to get a significant amount of protection. And secondly, the base rate you do have to look at is must include teenagers. So we're looking at 12-year-old upwards.
Are they going to be vaccinated now, over 12s?
Currently, there isn't a policy to, but if you're looking at percentage of people who are transmitting the virus, then we're looking at about 50% of the population that have been double vaccinated when you include teenagers in that, which you have to do because viruses are doing what viruses do. And we've seen the biggest increases in transmission amongst the 12 to 18-year-olds over the last few weeks.
Okay. Don't you also have to do, though, look at the proportion of rising infections compared to rising hospitalisations and deaths? There were 49 virus-related deaths on Friday, which is, manageable, I imagine, or acceptable perhaps to the population, it would seem anyway, compared to where you were, 8 months ago or a year ago. Is that the equation that the government and the British people are looking at when they weigh up whether they want freedoms, as we use the term that Boris Johnson has coined, versus ongoing lockdowns?
Well, the good news is that the vaccinations have weakened the link between becoming infected and going to hospital and dying, but it hasn't broken it. There's always a lag. So what we're now seeing is that following the huge increase in transmissions, we're now seeing hospitalisations rising very steeply, and now we're beginning to see deaths beginning to rise too. So it's a much lower level than previously, but it's increasing. And as I say, we have 5 million people on our waiting list for different degrees of urgency of hospital procedures that are needed, and those people are not going to be able to get treated. Our health service is going into a COVID-only service again, and the issue of long COVID is massive, including for young people,
Okay.
where even if you get quite mild symptoms, you can be debilitated for months, even up to a year.
Let's go to the restrictions that will be lifted today at this point, even as Boris Johnson and some of his cabinet are in self-isolating because of the infection with the health minister. There'll be no limits on socialising, no social distancing rules, no mandatory mask wearing, and nightclubs and theatres will open at full capacity. Do you think England could confidently open up if, for example, mask wearing continued to be mandatory?
Well, when you look at the opinion polls, 2/3 of people say they intend to carry on wearing face masks and socially distancing because they can see the massive threat, and that if we allow this pandemic to get even more out of control, it's only going to delay when we can get back to any kind of certainty about not only reducing restrictions, but also maintaining those. So that's happening. In addition to that, what we're finding is that local authorities, London, Manchester, etc., are all saying that people must wear face masks in transport.
Right.
Health and hospitals are saying people must wear face masks. Employers of different kinds of hospitality venues are saying their staff and customers should be wearing face masks. So what you're seeing, despite the government taking away the top-down legislation, is bottom-up. People can see the crisis we're in, the raging pandemic that we're in, and they are taking their own local decisions to say, we want to keep our staff and our customers safe. We ask you to carry on wearing face masks.
But it will weaken it if you take away the laws, and yet the messaging from the government seems mixed. I mean, we've got the Prime Minister, who's the one who came up with Freedom Day, saying, you know, please remain vigilant when meeting with others and carry on wearing masks. I'm not sure what remaining vigilant means. And you've got the Chief Medical Officer saying we're not out of the woods yet and the UK could get into trouble surprisingly fast. So what's going on? Why are they doing that if that's the risk?
We've had this before, the mixed messaging, and it's very destructive because what people want in a crisis is clear, coherent, consistent leadership. And that's what we've not got. We've got a vacuum of leadership. And so people, as they've done before, are just having to take it in their own hands to think what is sensible to do in this situation. But the lack of leadership, the inconsistent messaging is really undermining the efforts to get out of the pandemic. For example, the rates of vaccine uptake are going down. It's not surprising that happens when you get a government message by lifting all restrictions. By doing that, it's suggesting we're not in a crisis anymore. So younger people are coming to the conclusion, why should we have the vaccination? But the vaccination not only protects yourself, but protects other people because it reduces your chance of passing on the virus.
But what is sensible to do in this situation, depending on your situation? We've got someone writing in saying, I'm sick of hearing the well-paid, fully employed middle class calling for more lockdowns. They have no understanding of what it's like to run a business or work for themselves. There'd be a lot of people in England in that situation. A lot of people jack of the lockdowns because it's destroyed their businesses, their economic situation.
Absolutely. No, we shouldn't have a lockdown. We should never have had a lockdown. Other countries have managed to avoid having a lockdown. A lockdown is a failure of pandemic control. And we shouldn't have another lockdown. And that's exactly why we should keep going with the current level of restrictions, which aren't that heavy at the moment, for a couple more months till we can finish the vaccination programme, when it would be much, much safer to then lift restrictions. What's happening at the moment and what's being predicted by epidemiologists and a wide variety of scientists is that by going down this road, which is a lot of people think is very reckless, it's increasing the chance that there will be another lockdown. Nobody wants that. We don't want that. Yeah. And that's why we're saying keep the restrictions, get the pandemic under control, then you can lift restrictions. No other country has done what we've done, which is to allow transmission rates to get out of control, to rise exponentially, and then lift all the restrictions in the middle of it. We're not in lockdown at the moment. We can't go to nightclubs. Various things we can't do, but we're definitely not in lockdown. So it's just very premature and impatient to doing what the government is doing.
Susan, thanks very much for joining us.
My pleasure.
Susan Mickey is head of the Centre for Behaviour Change at University College in London and a member of the UK's Scientific Advisory Group for Emergencies Committee.